Good afternoon, everybody. Welcome to our bi-weekly webinar series. Today is Friday, October the 9th of 2020, and we certainly want to wish everybody, our Canadian friends, a very happy but social distance Thanksgiving this weekend. Make sure you stay safe and you follow public health guidelines for protecting your friends and your families. And our wishes go out there for sure. In the news worldwide, the numbers are increasing dramatically. Thousands of new cases this past week. Just today in Ontario, the highest record of cases discovered today were 939 cases. It appears that the second wave that we have been talking about for months now is here. The virus is now actually being referred to as the twindemic, part of the second wave, and really because of the first one and then now the second one there. So the scientists are calling it that. Provincial and state lockdowns are going on. Some businesses are really reducing services and hours. Just probably about 2:30 this afternoon EST time. I know the Premier of the Ontario is on, and they are considering shutting down inside service at bars, at restaurants, movie theaters, casinos, and gymnasiums again. Which is really bad news. And, we'll know that a little later this afternoon. Schools, colleges, universities, a lot of them are going back to virtual or certainly ramping up the percentage of virtual training versus in classroom. There's warnings about not gathering for Thanksgiving or Halloween and even Christmas now, as we're probably only about 2.5 months away from there. And really what they're saying, and we've said it several times over the past few months, if you do not live there, do not go there. Right. And that's just very simple advice, and I know it's a little painful, particularly around holidays and things like that. But I mean, really, we've got to get out of this. And I talk about that mirror every week. And the person looking back at you in that mirror is the one that's solely responsible for increasing or lowering the risk and the threat of COVID-19. Right. So I mean, it's up to every single one of us is what I'm saying. Public fatigue is impacting our world. The lack of patience is evident. Frustration is rising. And even in the last week, there's been a massive demand for toilet paper again. I have no idea why people look for this toilet paper here, because COVID-19 is not anything to do with your digestive tract or anything to do with that. I mean, it's a respiratory, but I guess people are buying it because they see some people with a cartload or whatever, and away they go. You can't find it in a store. Okay. And I know you need to have some, but I mean, that's just an example of how fast people start going out of control and exaggerating and things. And if you really practice social distancing, wash your hands, wear a mask, use alcohol-based hand sanitizer, particularly when hand washing is not available. You follow some of those basic things and we're going to be better off in the long run, but we can't preach that enough. The fact that, that's the way out of it. It's very simple. It doesn't cost anything to do that. As a matter of fact, pre-planning, large orders continue to come in for alcohol-based hand sanitizer, for ready-to-use and dilutable disinfectants, and pump-up sprayers, right? They're ramping back up again just every 5-10 minutes throughout the day. We're receiving those orders. We're in good supply raw material-wise. There are shortages of trigger sprayers. That rumor's going through North America right now. So if you do have a trigger sprayer, by all means, make sure that you reuse it. Keep your smaller bottles, buy some larger containers and decant accordingly, and away you go, right? We cannot stress enough that, keep those on hand. Place pre-dated orders with your distributors that basically say, I'd like to have X number of cases delivered on October the 31st or November the 3rd or 15th or December 1st or whatever. Your distributor will work with you to actually do that, but you are better to have more on hand. I know we've said this several times, more on hand than less. And what we don't want to do at Charlotte Products is actually have you not heed this advice and phone us or send in an order and us to have to share the bad news and say, sorry, you're at the back of the line. Right. So again, just heed that advice. So with that being said, let's begin today's session and we'll go from there. So thanks for joining us again. Friday, October 9th, 1 o'clock Eastern Standard Time. we're going to continue this educational webinar series here throughout fall and winter, by the way, and it's really all about cleaning protocols that lower the risk of an outbreak. And today we have a from a global pandemic perspective, we've got Dr. Helen Scott, who's going to join us for the question and answer period. And that'll give you a total different perspective. And we want to continue to give you these perspectives. I mean, 2 weeks ago, we had our grade 5, grade 8, and grade 9 students on there that really gave us an idea of what's going on the school bus and what's going on in the classrooms and the gymnasiums and things like that. And now we're going right to an epidemiologist here, Dr. Helen Scott. So we're pretty excited about that. Me, Jim Fleeler, Vice President of Sales Canada. We've got a lot of new registrants on today, so I'll spend a couple of minutes here. I mean, I've been in the industry about 40 years. I learn every single day, and I learn from customers, and I learn from really listening well. And this is just not me here. We have an unbelievable team of resources in the whole entire Charlotte organization across North America that are all industry experts and have a high level of enthusiasm. And we practice integrity day in and day out and transparency. And quite honestly, we are a good resource for you to utilize without question to help you lower the risk of an outbreak. Okay, this week's discussions, obviously bi-weekly, obviously cleaning protocols that lower the risk of an outbreak. And I've talked about Dr. Helen Scott, who's with epidemiology at the World Health Organization, and she's an assistant professor at the University of Toronto. And we're pleased certainly to have her on board for questions and answers. And she's going to give you that pandemic discussion from a global perspective. And what's interesting is, and I learned here by already talking to her for a little bit, we think we have it rough with the availability of disinfectants, and cleaning products and things like that. But what she's talking about is, look, the third world countries and unfortunate provinces and states and regions of the world, I mean, they don't have running water. They don't have washrooms. They don't have they don't have food. There's shortages and things like that. And then you take those pressures and you add in illness and things, and you add in a COVID-19 or whether it's whatever flu or whatever form of bacteria, whatever that's going through the world. And they really have it. I mean, really bad, as a matter of fact. And that's what Dr. Helen Scott's going to talk a little bit about today there. And then we're going to show our UNICEF video, which is 60 seconds, which I absolutely love, because if you ever needed to teach your grandparents or your parents or your children or whoever it is the importance of wearing a mask, watch this video 3 or 4 times. It's worth 3 or 4 minutes of everybody's time, because it just says it all. And it shows it all. And then the children and the kids can understand, the parents can understand, the grandparents can understand, and it's vital is really what it is. Okay. So with that being said, let's spend 60 seconds and we'll watch this. you found that as educational as I did, and believe me, it's worth watching it 2, 3, 4, 5 times there, without question. And one thing you did notice at the end of that, or maybe you didn't notice, and I'll point it out, is that you've seen the mother and the child wash their masks when they were done. Masks are not meant to buy and continuously wear without washing them. So a little bit of a cleaning tip there to help lower the risk and increase your safety there. Make sure that you wash these masks without doubt, because they do collect a lot of dirt and debris, and they could be carrying viruses and bacteria and whatever. So if you actually wash them, then you'll be much safer. Again, the largest area of failure is really following proper cleaning and disinfecting protocol. And it's really our duty to remind you every single time we talk about it, use the right product, use a registered product, make sure you read and understand the labels. If you're buying a retail product in a grocery store or a department store, make sure, just don't go by the brand name to say, okay, I've got this brand name, it's been around for 20 years and it's the greatest thing going. Read the instructions on every single one of those labels, right? We continuously field calls and say, well, why don't I just use that because your SDSs look a little, look like there's more precautions? No, if those retail products were covered under regulatory compliance and GHS, they would have nastier warnings on there as well. So read and understand the labels, whether you're buying through a distributor or buying in a retail store as well. It's for your safety, right? Dilute properly. More is not better. Less is not better. Regardless of the dilution method, it doesn't matter if it's a pump-up sprayer or a charge bucket or electrostatic sprayer or a fogger or mister, whatever. I mean, you've got to dilute properly. You've got to make sure that you pre-clean the surfaces. And this is where the major failure or concern is with these spraying devices. If you're just going in and spraying disinfectants everywhere without actually pre-cleaning, you're not getting not following the 5 steps of disinfectant security, and your results will be a failure, right? Respect the dwell time, regardless of what the label, or regardless of the label, follow it. That's one of the reasons why we say really understand that label and read it, because all of your dwell times are there. If you shortchange that, you are failing, okay? And then when food contact surfaces are around, a potable water rinse, and then or pre school toys or children mouthing and things like that. So that is really wash your masks, wear your masks, follow these proper cleaning and disinfectant protocols, right? What we will have in one of the sessions coming up, we've had a lot of questions for what disinfectant to choose. Why should I pick this one, or what does this one do, or how do I know which disinfectant I need? So we're actually going to have that as one of our topics coming up here shortly. And we'll explain to you the detergency level involved and the disinfectant properties involved and the type of facility and things like that. So we'll help you with that. So really, we're just about to go to our question and answer period here with Dr. Helen Scott. This is our 26th webinar in a row here, which we hope you've found valuable. We are continuing. Our next one is Friday, October 23rd at 1 o'clock, and that's about 30 or 40 minutes there. We're going to continue to talk about and update you on the most recent COVID-19 updates. And our special guests on October 23rd is we've got Mr. Jeff Swantes. He's our Vice President of Sales for the U.S. For Charlotte Products. He's joining us. And also Ty Huffer, who's the President of United Group, which is a national purchasing group organization, similar to when Giselle Gertran was in from the Ballpex organization in Canada. So you're going to get a perspective from the U.S. on really a group of national purchasing members there from there. And we hope that you'll find that educational as well. So with that being said, let's get into the question and answer period here with Dr. Helen Scott, who's our epidemiologist and works with the World Health Organization. Get a real perspective on global affairs that she's talking about. So this one's about 29 minutes long, as a matter of fact. So that's why I'm a little shorter in the beginning, and just stick with us here and we will go. And until next time on October 23rd, we'll see you then, and let's go to the video. Then we'll get to our question and answer period today, Friday, October the 9th. Asquith, number 26.
Imagine that already. Yeah.
We told you it was only number 5 or 6. We keep getting you to come in and coming back and back, but this is a 26th webinar in a row, actually, as a matter of fact. Yes. So gaining popularity and things. And today we have Dr. Helen Scott with us today, and thank you very much for coming in today for questions. And you know, it'd be great to have you here and get your expertise. Our customers have really, our webinar participants have been asking us time and time again for some panel guests to come in. A week ago, 2 weeks ago, we actually had 3 students from grade 5, grade 8, grade 9 come in, get a total different perspective on what COVID-19 means to them and the changes in the world, and if they really seem change that was positive. And it was interesting, from riding the bus to their classroom, to their grades, their differences, the eating habits, everything that's changed. And overall, it was interesting. And now we go right from them to Dr. Helen Scott. So again, thanks very much for coming in, you know, today. IT director, do we have any questions today? Thank you very much. You know, so we advertise a little bit, you coming in and things, and then live we take questions during it there. So he scrambles and gets them ready there. So how about a little history on you? What's your background's quite exciting, epidemiologist, things like that.
Sure. I mean, this is the first time being an epidemiologist has been this exciting in my career, and now people finally know. My mother finally knows what I do. Yeah. Which is really study disease incidence, and my focus has been on epidemics and disease control, particularly in women and children's health. So I started out my career working mostly in public health Ontario, so at the Kingston Health Unit, then the Peterborough Health Unit, and then quite quickly got interested in global health and the opportunity that we have through public health measures to improve the lives of large groups of people. So in 2015, in 2000, the world set a set of goals to reduce maternal and child deaths by more than 50%. Those were called the Millennium Development Goals. So this was in the year 2000. Obviously. By 2010, we were on track to meet most of the poverty reduction goals, but we hadn't even budged the goals around women and children's health. So for example, we had done a good job on schools, we'd done a good job on safe drinking water, but we've done a very poor job of maternal and newborn health. So the G8 summit was held in Canada at that time, and you probably remember all of the uproar around security and everything. Prime Minister Harper hosted that. And one of the really big successes that came out of the G8 summit held here in Canada was the Muskoka Initiative. So that was the Canadian government and the Conservative government's leadership on maternal, newborn, child health. So they really picked up the torch on improving the lives of the poorest women and children around the world and reducing death rates. And also Canada invested a lot of money in that work. So I took on the job shortly after that of coordinating Canada's effort. So there was a big effort happening through the government, but civil society, not-for-profits, actually deliver the programming in countries around the world. So I created an organization that coordinated those programs and really looked to help those organizations track results. So for example, you might have a church-based organization that's delivering health programming with Canadian government funding, but they might not be doing the most up-to-date work, or they might not be going by sort of the medical guidelines to deliver the programming. So what the organization that I created did was help those organizations to have the best practices and then to really track their results. Perhaps you're funded to deliver vaccines. Did you receive the vaccines? Did you deliver the vaccines? And were the vaccines effective? Those kinds of things. So I did that work for the last 10 years, and I just left my role in June. I got pulled by this pandemic to kind of really dig back into my roots around core public health, and I started a job at the World Health Organization with a department of the WHO that I've been working quite closely with, and it just started there not too long ago. So really exciting to be on the ground at this time.
Good for you. Yeah, they must be proud of what you've achieved for sure, and really your contribution to a safer atmosphere, safer planet, I guess, overall. Right?
I feel like Canadians, it's a story that Canadians don't know. We should be very, very proud of our effort in global health. And it always surprises me that the average Canadian just doesn't know the extent to which we are literally building health systems and health programs in thousands and thousands of communities around the world.
Pretty sad when it takes a pandemic to get our attention, overall. And, we've always said, I mean, look at this is all about learning. What we do at Charlotte is obviously, knowledge transfer and learn every single day. And what we've learned by just doing this webinar, because our customers have asked us to do this webinar, and it's gained so much traction worldwide. And the sad part is we've been preaching cleanliness and proper disinfectant and cleaning protocol for how many years, Asquith? And
many years.
Some people pay attention, but most don't. And hopefully now it's that they'll pay attention for sure. Well, thanks very much for joining. I've got a list of questions here, and that we'll go through. And here's one from Jamie here that says, we tend to focus on the impact of COVID-19 in Canada, but obviously it's a global pandemic. In what ways is the pandemic impacting less developed countries, for instance? So,
I mean, we're thinking and tracking these numbers here at home. Most people are comparing numbers to other countries. For example, our neighbors to the south here in Canada, we compare our rates to the US or communities. We're in a rural area where we're filming right now, but we might be comparing ourselves to Toronto. But the reality is that we're actually pretty fortunate. And that's because in developing countries, the impact is not just the disease and the illness, but also around just poverty, increased poverty. So kids aren't in schools.
Parents can't work.
The parents can't work. There's been an economic slowdown just because trade is shifted. There's no travel. I mean, the impact in developing countries is just really, there are estimates that it might set us back 10 to 15 years. Then there's also the fragile context, communities and countries that perhaps are in the middle of civil war, where there's been some kind of a natural disaster. I mean, the impact is just even tenfold that. And on top of that, the humanitarian organizations that often support in these situations aren't traveling. So a lot of programs have had to shut down, and we don't yet know what the true impact will be.
Yeah, it's going to take years for that, right? I mean, and without them, correct me if I'm wrong, but without those people that help make decisions and guide, without them being able to visit on the ground to see for themselves, I mean, that's probably going to slow the impact or the change down a little bit more, right? Because seeing is believing. I mean, we're a visual industry for sure, and that's that's terrible for sure.
On one hand, on the other hand, there is some optimism here.
Yeah, because we like optimism. We do.
Africa is, if we speak about Africa, they actually are quite experienced in the last few years at having their own Ebola outbreaks. So lots of different countries in Africa are actually ahead of us in knowing how to manage a pandemic and got out and have done better than some of our, Canada, for example, but also there's younger populations. So we do know that COVID itself is not hitting the populations quite as hard, and that's probably a factor of the age of the populations. But there's a little bit of south to north learning here where we can learn from the experiences of these countries who actually do a great job around pandemic management. Yeah,
well, that's good. Well, hopefully, I've always said all along, you've heard me say, I think we'll come out stronger on the other side, when we come out, but then we'll have the next challenge. It's just like whether it was Zika virus or influenza or Spanish flu or avian flu or Hong Kong flu, or it didn't matter, it didn't matter what it was. I mean, we always, as long as we're learning from that and trying to make it a safer place.
Well, you can see we are actually learning a lot from this. You can look at the mortality rates now than there were in comparison to where they were last several months ago. The doctors are learning more, how to handle the patients. Even us as citizens are learning more. We should wear masks, wash hands, social distancing, and that's getting through as well. So we're all learning, really.
And it's funny, you talk about that we weren't well prepared, but in my profession, in every job I've ever had, we do pandemic preparedness. But having the political will to be prepared for a pandemic and actually being prepared are just two different
Yeah, two
sides
different
of the
things, for sure. But
effort. So, and we could speak about this on all manners of public health.
Yeah.
It's getting the political will to actually to drive the programs and policies that you need to have in place to protect populations is a big challenge.
Yeah, for sure it is. But, hopefully we come out stronger on the other end. Here's one here, Steve. We often hear leaders from the World Health Organization speak about we're all in this together. While we are focused on controlling the spread of COVID-19 here at home, what does it mean to Canadians if we're unable to keep the virus under control outside their own borders?
Right. I mean, and there was a debate in the early stages of when do we shut down borders and the trade-offs between the economic hardship and the
health aspect.
Exactly, right. And then of course the people question the decision, whereas had they made a decision to shut down borders sooner, who knows where we would have been. But I think the reality is, and this is with all global health issues and global health security, that we're only as safe as the people around us in a globalized world where there's so much travel and there's no way to think about this as happening within this community, within this country, within this continent, because that's not the world that we live in.
It shows basically how small the world is and how integrated we are.
Exactly. A few years ago, I was in Senegal during an Ebola outbreak, and I was actually exposed to someone, unbeknownst to myself, who had been exposed to someone who had died of Ebola. And, and I traveled home and I was quarantined. But I remember at the time thinking, I can't even believe that I could travel home.
Yeah.
It's
but look at the checks and measures coming in with the airlines today. I mean, the temperature checks, all of the sign-offs and quarantines and everything. I mean, I'm a 100,000 mile guy every year, and I haven't been on a plane since March 3rd, and I keep saying this, I don't miss it, but I'm actually a little jittery about actually going back on a plane, regardless, because it's a mobile society. I mean, I could travel anywhere, and you could travel anywhere in the world in 24 hours, right?
And bring whatever bugs we bring.
In that airtight space capsule, and with all your friends in the airports and everything else, and I mean, it's not known as the best quality air, but I mean, it's on the planes, and if they're cleaning protocol, they turn around a jet in about 7 minutes, I think, and just disinfectant protocol alone, the average dwell time is 10 minutes, and if they're turning the plane in 7 minutes, obviously there's something getting hit there. That's for sure. But that's,
I just actually on Steve's question, how does this impact us as Canadians? The Canadian government this week actually made some pretty big strides. So there was a speech from the throne from the Prime Minister just about a week ago, where they announced that Canada was participating in the COVAX, which is a global program to develop and administer vaccines to developed countries. So Canada invested $200 million there. And then just yesterday actually announced a $400 million investment in humanitarian relief for fragile contexts that are struggling as a result of COVID. So again, this is another one of those opportunities for Canadians to be proud of our work on the global stage that we don't often hear about, and it barely makes the news.
Well, that's good about having you in today, so you can start sharing some of that knowledge with us as well, and we'll all learn together there for sure. Here's Janet. In 1918, we lost approximately 40 to 50 million people throughout the world due to the Spanish flu. There have been recently been comparisons of both of their curves between COVID-19 and that one with the Spanish flu, an initial ramp up and then a flattening trend, and then an accelerated increase. What are your thoughts of this, and should we be extremely concerned of the similarities?
Good question. It is a good question.
We get great questions from the audience.
So first of all, we're dealing with a coronavirus and not the flu, but it's actually remarkable how similarly they're behaving, these two bugs, if you want to call them that. So the death count, I think, from the Spanish flu, she said 40 to 50, but I think the estimates were sort of between 50 and 100. What we've seen so far is a greatly reduced mortality rate from the COVID-19. Although, if you look at specific areas like northern Italy or like New York, what we were seeing in those pockets was very similar to the Spanish flu. So it's hard to generalize. And as you just mentioned, we've learned a lot since the spring. I mean, things like wearing masks, things like social distancing, things like
washing your hands.
Key. Is huge, and even just then treating the coronavirus, understanding better. So we're not seeing death rates kind of keep up with the curve right now. Fingers crossed. And there's actually some speculation that some of these practices, like washing our hands, like wearing the mask is having a natural inoculation effect, potentially.
Right. Yeah.
Like, it's one potential explanation of why morbidity and mortality rates are not following the curve yet, which is that we're potentially actually getting a smaller dosage of the virus, which means that there might be people who are very asymptomatic, who have the virus that we're not catching, or just have milder symptoms.
Yeah.
So that I'm trying to be optimistic here. I do think we need to be very concerned about what's happening, and hope that governments are listening to the infectious disease specialists to kind of pull the various levers to control population spread, but then also some optimism around tracking those morbidity and mortality rates and hoping that they don't follow the curve.
Yeah, for sure.
Great question by Janet.
Yeah,
because
absolutely.
history tells us a lot.
Yeah, well, they do. Yeah, it does. There's no question. And I have heard she did say 40 to 50 million. There is lots of documents that say that, but then there's the secretive documents, the ones that aren't advertised as much, that say as many as 100 million. So I agree with you 100%.
Yeah.
I mean, regardless whether it was one death that was avoidable, it's it's not good.
And interesting how political it was in 1918, and people didn't want to wear masks then, and people thought it wasn't real.
And then all the questions on how it started. I mean, they blamed it the Spanish flu, called it the Spanish flu, and it apparently originated in the U.S. somewhere on a steamship going over the ocean. And there's all these different things, but history is good there. Here's another one here from, this one here is from Jen. It says, Helen, doesn't say Dr. Helen, but it says Helen, which is okay. After watching today's UNICEF video, because we played that for you a little earlier there, on wearing a mask, do you believe that this is one simple way to prevent the spread? And what would you suggest ensuring that the entire world is encouraged to follow this? Maybe watch the video?
The video is so cute.
What did you think of that video?
So I think it's great. I mean, public health is tough. So trying to get an average person to digest a public health message and follow that message. And it's no different if you're trying to stop drinking and driving, if you're trying to get people to stop smoking, to wash their hands, to have sanitary practices in their washrooms, these kinds of things. It's not different. So, I mean, in the work that you do, I'm sure you probably pay attention to that sign on every washroom wall that tells you how to wash your hands properly, but does anybody ever actually look at this? So finding innovative ways to communicate messages to the public, I think, is so important. So that cute little video, I just thought it showed these gremlins as the virus and this really simple way that you could protect yourself and protect your family. I thought it really had an emotional pull. So kudos to, I think it was UNICEF India that pulled that together.
They did it, which is great. I mean, UNICEF is obviously a great organization worldwide in the whole works, and it was actually Asquith that sent it to us, discovered it, and I looked at it and I said, that is unbelievable. 60 seconds of just the reasons why, right? And how simple that little gremlin, the individual put his hand on a bar and then in the nose and then sneeze and away we go, and that's exactly how it happens. And I know when our grade school kids were in there a few weeks ago, we showed it to them as well, and they get it, and then we asked the question, why would you wear a mask? And they said, well, that's to keep the illness inside from spreading. Right. That's exactly what I believe Alexa said there, which was great.
And if you look at the evidence, then countries that have standardized practices around wearing masks, where it's quite culturally normal, and who did this much earlier in the pandemic, in Singapore, New Zealand actually implemented masking pretty soon. Those countries have done very well. So this is clearly a practice that's going to be part of the overall recovery from COVID and getting through this.
I think it really does come down to a mask. I mean, as the simplest, easiest, least expensive way to do something to protect people. I mean, it really is there. And you see these public gatherings in all these major cities and things, and obviously what we've always said, Dr. Scott, is we've said there's a thing on the wall called a mirror. And when you look in that mirror, that is the one 100% responsible for stopping or increasing or lowering the risk of an outbreak and things. And we've carried that message on for months, right? Absolutely. We have there, and people say, oh yeah, that person looking back, it is, right? So
it's all about us.
And I mean, there's a lot of public fatigue now with COVID, and a lot of irritancy and a lot of impatience, and we've been, basically working with people, encouraging them to keep a smile. You've switched it from a little negative here to some optimism and things, which is great, because we need that world full of optimism today. Mm-hmm. We really do, and that's. But anyway, we'll get to.
Well, and I mean, for women, we don't have to wear makeup anymore. Your face is covered. It's fantastic.
Yeah, but Asquith's still wearing it. Is what he's doing. I mean, what have you got on today there? I mean, how many different kinds?
I don't have to shave anymore.
Exactly.
Before we come in the studio, he has to spend at least an hour in the makeup studio there. This is what he has to do there. That's great.
The lipstick sales are probably very much going down.
Yeah, probably. There. I notice you're a little duller than you used to be, though. There, a little less sheen and whatever there, so you must have cut back. But we always have to get him going to keep him awake during these things. He gets back there. But here's Sam here. What percentage would you estimate the world of disinfectants are used properly? Would you estimate of the world's disinfectants are used properly? How many facilities you think follow the 5 steps for disinfectant security? And if we adapted the cleaning protocol and disinfection protocol, do you think it would benefit the world?
Yes.
Right? Interesting statistics on.
Great question, and I'm here in my speaking in a global health perspective.
Yes.
So I think the first reality is that there are many places in the world. In fact, more people don't have access to clean water and sanitation products than do. So I think that is something that's just a reality that most people face, and that water and hygiene is just water, sanitation, hygiene is just something that we need to build in all communities around the world. But in places like communities like ours, where we are fortunate to have access to the products and the knowledge and the resources to be able to have clean water and soap, it's still about 95% who just don't do it properly. We talked about that sign on the wall in restaurants and those kinds of things. Who actually washes their hands for 20 seconds, right? So the reality is we don't do a very good job, even when we have all the materials in the world to support that effort.
So there's room for improvement.
Absolutely.
Look at a restaurant when you go, and you go in and the host or hostess is there, and whether you got a reservation or you're there for a table and you're sitting there, and they say, "Oh, just bear with me," or "Just follow us for a second," and you go, the people have barely left the seat's still warm, and there's still plates and everything else on there, and they come up with a little spray and a cloth that looks like it's been in 75 other tables before it got there, not clean, not a fresh new one or whatever. They do a squirt, they give it a wipe, and they throw the condiments and salt and pepper or whatever back on there, and you sit down and it's still wet. Right? And I mean, right there, that's a foodborne illness potentially, which is a very serious, issue that you have. And I mean, we just don't get it. And then we've been preaching 5 steps of disinfectant security, which is the right product, registered with Health Canada, particularly in Canada. And we've been talking about proper dilution and pre-cleaning, removing, organic film, gross filth and debris, and then applying the disinfectant, respecting the dwell time, which is generally 5 to 10 minutes, depending, whatever it says on the label, and then using a potable water rinse on food contact surfaces or around children that are teething, mouthing, handling toys and things. And it just doesn't happen. I know we field calls all the time to say, what do we need? Do we have to do this? And we'll say to them, well, do you use a disinfectant in your kitchen at home? Well, yes. How do you use it? Well, we just spray and wipe. Have you ever read the instructions? Well, no. Have you ever read the warnings? No. I mean, and and then all of a sudden, it's a good thing, I guess, that they're learning. But so 95% is, I mean, it's a scary thought. I mean,
here's another point too.
Yeah.
Even during using a diluted product, ready-to-use product, or a concentrated product that was diluted, I see often people would put a microfiber cloth and they have it soaking in a quartz solution. Yeah. And then they wring that out and they go around and they keep wiping.
Yeah.
It's also bad because there's something called quartz binding, where quaternary ammonium compounds carries a positive charge. And then it's attracted to the negatively charged microfiber cloth. So let's assume you had a perfectly mixed, diluted system that came through one of our dilution control systems, and you check that potency and you got X ppms, and you soak a microfiber cloth into that, what happens, and then you wring that out and check what you wrung out, you will see that it's two different numbers.
Yeah.
And so that goes on and on and on, and it's an exponential negative curve.
Yeah.
So I might
that you-
have a
So that has a exactly, that has a negative effect, because now you're not carrying the concentration that you require
right.
for the actual kill, so to speak, for the bacterial kill. And so you can see how you can perpetuate and have superbugs, because people are not following the use directives.
Yeah. So it's easy to achieve 95% failure.
Absolutely.
That's what we're saying.
And you see that every day.
Yeah, and we've been really discussing that at our webinars, because part of our responsibility is education, and we're trying to educate everybody of every level in a common sense format and things. I mean, there's no sense talking way up here when people are here, and I mean, so we're really gathering children to seniors, and everything in between is what we're doing there. So it must be unfortunate, some of the parts of the world you've been in where there is no water, or not clean drinking water, or no cleaning supplies, let alone a disinfectant and thing. I mean,
Toilets.
yeah, toilets.
Toilets are a luxury in most places in the world.
It's just I've never been exposed to that other than anything that's been on TV, I guess, or the internet or something. But that's just got to be terrible, there. So thank you for helping out in the world and the things that you do.
Well, and I was going to say, to your point around just your common practices at home. So I might have a PhD in infectious disease, but actually I'm a mom. And when the kids used to come home with with bugs, as they do, it was fascinating to me how many families just accept that this is going to go through the house. And they didn't take those precautions to increase their cleaning, the amount of time they're cleaning, to make sure they're using the right products. And, I always compare my home to my sister's households, and I could usually get it stopped.
You're not going to put your sister down here, are you?
But they
She'll be watching, probably.
They didn't take the time to just do the extra clean and to follow the instructions
They
and
were
have the right
practicing,
products.
I guess, herd immunity.
Yeah, exactly.
Well, you look at, I mean, just as innocent as what you just said. I mean, one of them comes home, say you have 3 or 4 children, one comes home ill, laundry all goes in the same hamper or the same basket and the same washing machine and everything else, and that's how easy it's. Now, we've also got to use common sense, because the body's quite a miracle with immunities and protection and things like that too, but this is just exactly how easy it can happen, right?
And it isn't a given that it has to go through a household or through, we don't have to have herd immunity to get through COVID. So.
Exactly.
Yeah, for sure there. That's good. Okay, so we got a couple more questions. I think what have we got, Chris, 5 minutes or so? Yes, okay, that's what we have. So we've got 2 more here. Do you have any predictions for this fall and winter season and the impact that flu may have with mutating with COVID-19? It's been in the news all over the place. What are your thoughts? Any predictions?
My predictions. So, to be honest, I think we have to go back to what we've learned from history. So we know we appear to be in a second wave. It's very likely that there will be a third wave. With the Spanish flu, we know the second wave was actually far deadlier than the first wave. Yeah. So we're not seeing that right now yet, and that may be a function of the practices that people are undertaking, may be a function of the virus itself. So my prediction is that we can't predict. That, we know so little.
Neutral position, but a smart position for sure. Yeah, definitely there. I don't think it. Now, we talked in a previous webinar about the lower rates of infections in the southern atmosphere, that because they're already in fall and winter right now, and remember they're dramatically less cases than what they had before. But okay, so our last question here, I guess, what do you see as the most valuable role manufacturers like Charlotte Products, I've put a plug in for us, along with their distributor partners can do to make a difference? So what should we be doing different or better or whatever? Any suggestions there?
So a couple things come to mind. So first, I mean, you are the experts in how to keep things clean, how to disinfect. And I think exactly what you're doing, getting that message out there that it isn't as simple as dumping some liquid in a bucket and then washing your home or your desk or your restaurant with a microfiber cloth or something. I think what you're doing to educate the public is so important. And as part, I think we often forget the role that the private sector can play in driving markets, right? So in marketing products and communicating how to use them, I think that is really, really important and a great place for companies like yours. And then the second, of course, I come from a global health background, and that's where I'm working. I think the second area of focus is just that in those developing countries, there's a real opportunity for companies to work with those communities and countries and to make a massive difference. And it's the place where a little bit of effort and a little bit of investment can actually change lives. So yeah. I think that would be something else that if I were to think about what could your company do, that would be a great place to put your energies.
Yeah, we've, the circles behind you really is our value proposition there, and we always keep our ears and eyes on the industry, what's happening in industry insights, so what are the challenges, what are the issues and things, and then we have in-house our development team, our innovative products and development team there, that we develop those products then, and then we have our real skill set is that experience and really the knowledge transfer into the people there. So again, it's helping us dramatically there is what it's doing. So any closing remarks from you? We're getting our timer here on the board that's telling us cut, and it never goes long. Any closing remarks from you?
No, just great work. I'm really delighted to have a chance to be here. I think we often don't think about all of the pieces that it takes to build a safer world. I love your mission statement, and it's really great to just be part of this conversation and to think about how do the products that you produce actually help to get us through a pandemic, but also just to create a safer world in general. So thanks for having me.
Yeah, no, thank you for coming in. I've learned several things there from you, and your smile is infectious for sure, and we appreciate everything that you're doing. Ask with any closing remarks from you.
Well, thank you very much for coming in and educating our population. We've got a group of customers that just eager for knowledge, and thanks for helping us transfer some of that knowledge to our customers.
My pleasure.
For sure. So with that being said, you didn't say about washing your hands with your standard
of course,
closing.
Well, our standard closing is always the same. Keep washing your hands.
Yeah, for sure. And I think our next webinar is Friday, October 23rd, I believe it is, at 1 o'clock Eastern Standard Time. And until then, obviously stay safe. And again, Dr. Scott, thank you very much for coming in. We really appreciate you taking valuable time and coming in today. It's been great to actually have this discussion with you there and pass on a little bit of knowledge for people to really help lower the risk of an outbreak. So again, thank you very much.
Thanks again.
Thank you.